I think that our residency program obviously has a very unique position in being the first and only sponsored program by a community health center. Back in 1993, when we began the residency program, we really didn't think about how unique this program would be, but rather how we can meet the needs of a growing demand for primary care back then. Of course, since that time, those demands to increase the primary care workforce have grown significantly. And the challenge continues to be recruiting the highest quality candidates to our program and graduating folks who go on to provide excellent care, not only here in Massachusetts, but throughout the country.
If you look at the big teaching hospitals as an inpatient example, why are they recognized as being great hospitals? It's because they've got residencies. They train doctors in those locations. We're the outpatient equivalent of those big tertiary centers in terms of physicians. We're just like the big institutions in Boston are training the best and the brightest on the inpatient side. Lawrence is actually training the best and the brightest on the outpatient side. I mean, the other thing is these are people that are on a mission. I mean, they're not just going with the flow. You know, it's just easy to say, okay, I guess I'll go be a dermatologist and go with that. But these are people that actually went against the advice they got from many of their faculty in med school. So I think it is a special kind of person that is saying, you know, this is what I'm about, and to have that presence of mind and that independence of thought and that spirit is really why I think you know, we're just getting the best of the brightest to work with, and it's a lot of fun to come to work. And the faculty always remark how wonderful our residents are and just what stellar people they are and stellar physicians they're going to be.
I came into the residency program coming from medical school where there at that time wasn't a required family medicine rotation. There is now, but there wasn't then, and had been told by many faculty, don't be a family doc, don't be a family doc, and felt like, did I make the right decision? But followed my heart. I came out very confident as a family doctor and left and went to a place again where family medicine was viewed as not something that smart people did, and was able to be very confident in the fact that I was a family doctor and I knew what I was doing, and family doctors know what they're doing and they have value in the healthcare system.
I think that the dilemma for Massachusetts and actually for the country as we go forward with healthcare reform is the access to primary care and the need to improve that access, while at the same time, unfortunately, funding for residency programs like ours is going in the opposite direction. That is a dilemma that we as a state and as a nation need to face and address, because we know that there is evidence that there will be a significant need for more primary care physicians in the future, and that more access to more primary care will actually improve health outcomes and reduce costs.
The opportunity to be in a community health center, I think in this time is really pretty auspicious. There's a national movement with the recently passed healthcare reform. There's a big recognition that we need to support our community health centers nationally. And just this morning I was on the phone with the legislative person on Capitol Hill trying to get more information about what our experience in Lawrence is, so that we can take this model and it can really transplant it to other places in the U.S. So that it's a pretty neat place to be in that regard, that our reputation really is national, it's well known, and I think leading other community health centers into graduate medical education and trying to improve the quality of care that we're providing our patients is a pretty neat place to be.
I want to thank everybody for allowing us to bring our story to you tonight, and I want to thank you for your support, not only of the health center, but of our residency program. I hope you've enjoyed the evening. Our pledge to you is that we will continue to do what we do best. That is to provide the highest quality primary care here in the Merrimack Valley and to continue to train the best family medicine physicians throughout the country. Thank you again, and have a great evening.